Hello, my name is Gabrielle. I'm a second year physiotherapy student studying at Robert Gordon University in Aberdeen. I'm currently here in the Western Isles Hospital on placement, and today I'm going to be answering some questions and telling you a little bit about careers in physiotherapy. So I think being able to help people is an obvious highlight of the job, especially since you can physically see the impact that your work has on people's lives. Whether it be helping people relieve their pain or helping them learn to walk again, it's very rewarding to see the progress that you've helped them make. I also think that physiotherapy is the perfect mix of academia and hands-on work, so having a job that requires lots of problem solving but is also very practical means you're not stuck at a desk all day, which personally for me was very important. So currently, due to coronavirus, I think the most challenging part of physiotherapy is the inability to treat and assess people face to face. The majority of physio is shifted to online and virtual assessment, which makes it hard as we're unable to use our hands, which is something that we usually heavily rely on. That being said, the use of technology has been very successful so far, so I expect some aspects of this will remain even after the pandemic, which is great, but it's definitely something that will take some time to get used to. So to be considered for a university interview, the standard entry requirements for an undergraduate physiotherapy course in Scotland is 2 A's and 3 B's. This usually has to include higher English and at least 2 other higher science subjects, so I personally did biology and maths as my 2 sciences. It's also recommended that you have some relevant work or shadowing experience, either with a physio or just in a healthcare environment. This is so that you can talk about this in your interview, as you'll need to demonstrate a general understanding of physiotherapy, of what the physiotherapy is, and also your interest in the course and the future profession. So the most direct route into physiotherapy would be completing a 4-year degree in one of the 3 Scottish universities that offer an undergraduate course. However, 4 Scottish universities now offer the opportunity to become a fully qualified physiotherapist through a 2-year pre-registration master's course. This is a postgraduate degree, which means you've already completed an undergraduate degree in a different subject. So to access this course, you need to possess a bachelor's degree at a 2-1 classification or above, usually in a science or engineering subject. So for example, you could have a degree in sports and exercise science or something like biomedical science. So over the last few years, there's been massive developments in career progression opportunities for physios. So within the NHS, you can work up the band system, reaching jobs such as team leads or in management. There's also the opportunity to become extended scope practitioners. These are clinical specialists in their chosen areas, such as orthopaedics, meaning they have a vast range of skills and experience which allow them to undertake medical duties and procedures usually outwith that of physiotherapists. There's also jobs as first contact practitioners. These are advanced physios that are working in GP practices, treating patients firsthand who come in with musculoskeletal problems. So physiotherapy is very much a patient-centred career. Therefore, being able to communicate and listen to your patients, I think, is the most important skill that you can have. Showing empathy to them in their situation will allow you to fully understand their condition and give them the treatment that they need. No 2 patients are exactly the same, so being able to problem solve and adjust and adapt your skills to each individual is vital when assessing patients. Also, being able to show patience when perhaps situations don't progress as well as expected is also important. So I'm currently in my 2nd year studying physiotherapy, and I'm honestly loving it, so no, I wouldn't change my degree at all. There are many different areas and specialities that you can enter through physio, and I'm enjoying learning about them all. So this is definitely a career path that I would recommend to anyone looking to enter the health service.